a motion on the need to investigate gross inefficiency of the National Health Insurance Scheme, NHIA, for improved services delivery to Nigerians, standing in the name of Honorable Kwamoti Laori. Honorable Laori is hereby invited to move the motion.
I speak for the people of Jamsa, Numan Lamude Federal Constituency. My name is Kwamoti Laori. Mr. Speaker, the House notes that the National Health Insurance Act 2022, which replaced the National Health Insurance Scheme Act, seeks to promote, regulate, and integrate health insurance schemes, secure mandatory health insurance for every Nigerian and legal resident, and establish a fund for subsidy of health insurance coverage for vulnerable persons and payment of health insurance premium for indigents. Also notes that since the passage of the National Health Insurance Act, the scheme has enjoyed the cooperation of the National Assembly in terms of annual budgetary allocations for it to perform optimally in delivering its mandate to Nigerians, with the primary objective to ensure affordability of health care for all, especially the poorest and most vulnerable Nigerians. Concerned that enrollees in urban and semi-urban settlements have received extremely poor services from health maintenance organizations, HMOs, both private and public health facilities, which is distressing given the harsh reality that Nigerians are faced with removal of fuel subsidy and other economic policies of the government. Also concerned that the attitude of medical personnel and healthcare service providers treats enrollees' patients as trash, subjecting Nigerians to unnecessary delay with the aim of frustrating patients from accessing services, while the HMOs smile to bank monthly for services poorly rendered, a situation many Nigerians describe as dehumanizing and fraudulent. Aware that most enrollees have recently chosen to pay in full for medical services in establishments other than HMO they subscribe to, in order to avoid needless stress and harassment that characterize the enrollee patients like beggars, devoid of human dignity and respect. Further concern that the scenario further undermines Nigerian trust in the program if left unchecked, and considering how crucial a healthy population is to the country's productivity, the purportedly demonizing treatment of enrollees and the regular out-of-stock or shortage of necessary medications and consumables in the majority of HMOs requires an urgent investigation. Worried that wherever possible, the enrolled patients are made to purchase out-of-stock drugs and consumables outside. They often do so without a refund or any form of compensation from the HMOs, which raises questions about the integrity of the scheme. Also worried about the growing allegation of abysmal service expressed by Nigerians, with different unpleasant accounts of frustrations and dehumanized treatment in various HMOs across the nation. Recognizes that unchecked behavior of this kind would amount to fraud and gross disservice to the Nigerian citizens on whose behalf the government is funding the program, as well as further eroding the citizens' faith in the current administration's Renew Hope agenda. The House do resolve, 1, to mandate the Committee on Healthcare Services to investigate the cause of this alleged gross inefficiency of the National Health Insurance Scheme and recommend ways the scheme can be made to function more efficiently and report back within 4 weeks for further legislative action. Secondly, to mandate the Committee on Legislative Compliance to ensure compliance. I so move, Mr. Speaker.
Latum of our constituency. I stand here to support the motion raised by my chairman, Honorable Kwamoti, and I so second.
The ayes have it. This motion is referred to the committees on healthcare services and legislative compliance for further legislative action.